ST2 and endothelial injury as a link between GVHD and microangiopathy. Definition. There is an association between elevated levels of ST2 proteins, a marker of endothelial injury, at the time of diagnosis of graft versus host disease and resistance from glucocorticoid therapy among the recipients of hematopoietic stem cell transplantation. ST2 is independent of natriuretic peptides, such as natriuretic peptide BMP and NT-proBNP, and therefore provide unique and complementary prognostic information. GVHD means the graft reacts against the host. The graft is the donated marrow of stem cells. The host is the person receiving the transplant. In an angiopathy affecting a small blood vessel in the body, it can be constructed to angiomyopathy of large vessel disease. Transplant-associated thrombosis and microangiopathy is triggered by endothelial injury, leading to complement activation and further endothelial injury, organ failure, and decreased mortality. Application in medicine. Authors found a strong association between ST2 levels at day 14 after transplantation, a point well before the onset of GVHD, and rate of death at 6 months among patients without a relapse in disease, but the cause of increased mortality was not clear. They have reported an incidence of TA-TMA of 30% in prospective study of screening for clinical signs of TA-TMA, including elevation of latent dehydrogenase level, the presence of thrombocytopenia, decreased aptoglobin, microangiopathy, anemia. Endothelial injury also occurs in GVHD3, and TA-TMA and GVHD frequently overlap with clinical evidence of both processes. In addition, endothelial injury is reported to be associated with glucocorticoid resistance in GVHD. Pros and cons. Pros. The careful evaluation of transplant recipients with glucocorticoid resistant GVHD for signs of TA-TMA might identify additional therapy option. ST2 has considerable prognosis value and is used as an aid for risk stratification in identifying patients who are in high risk of mortality and hospitalization. It is difficult to say who will develop GVHD after a transplant. We don't know exactly, but somewhere between 1 and 4 or every 5 people. 20% of 80%. Having a donor transplant will develop some degrees of GVHD. Conclusion. An elevated ST2 levels was significantly associated with TA-TMA in all 3 cohorts. As a variable has not reported, and perhaps an important cause of the excess mortality, we address the relationship between TA-TMA and GVHD using multivariate linear regression in data for recipients of allogenic stem cell transplant. There are treatments to prevent GVHD. Dr. fine-tune the use of this treatment. They try to lower the risk of serious GVHD as far as possible, but still keep some benefits of GVHD.